In this video, we show how we carry out a thumb metacarpophalangeal joint arthrodesis with the shark screw allograft. The patient is a 73-year-old female on whom we are performing a resection and suspension arthroplasty due to carpometacarpal joint arthrosis of the left thumb. The patient also shows hyperextension in the metacarpophalangeal joint, which is why we perform a metacarpophalangeal arthrodesis in addition. We make a straight dorsal skin incision over the metacarpophalangeal joint of the thumb. We separate the extensor system, cutting through the collateral ligaments, and expose the head of the metacarpus. In this case, we decide on the cup and cone technique. With a double-pointed 1.6 K wire, we mark the center for the conical head in a slightly palmar position. This wire already defines the direction for the shark screw allograft, which will be inserted later. We ream over the guide wire with a 16mm cone reamer. Next, we place a central K-wire into the base of the proximal phalanx, where we remove the cartilage all the way to the subchondrial bone with the cup reamer. We use a thin 1mm drill to freshen the partially sclerotic bone. The shavings remain in place. Now, we place both joint surfaces under maximum compression at an angle of around 20 degrees. We introduce a 1.6 K wire from proximal dorsal towards distal palmar. To ensure stable positioning during later drilling and threading, we additionally set two temporary 1mm thin K wires. Now we replace the thick 1.6 K wire with a 1.2 wire, which serves as a guide wire for drilling with the thinnest, the blue, drill. Based on the size of the bone, we decide which dimension of shark screw to use. We always try to use the allograft with the largest diameter. This ensures that a maximum amount of bone bridges the arthrodesis gap. Drilling is carried out step by step, starting with a small drill and enlarging to the desired size. In this case, we used the 4.5mm shark screw, marked in red. To prevent heating of the bone, threading is carried out slowly using the red 4.5 thread cutter. The depth of the drill and of the thread cutter is shown on the laser markings. Finally, we thoroughly rinse the female thread with saline solution, because even small shavings would prevent the screwing in of the shark screw. After insertion of the shark screw allograft, we remove the temporary K-wires and cut off the protruding screw material with an oscillating saw at bone level. The shark screw allograft ensures an absolutely rotationally stable arthrodesis that is under compression. It resides within the bone and does not rise above its surface. Shark screw allografts are clearly visible in postoperative X-rays. By the physiological bone metabolism, the bone screw becomes completely integrated and remodeled to our own bone material. After the operation, we apply an open thumb cast for 3 weeks. The arthrodesis should be kept load-free for 6 weeks in total.